When the patient comes in, they get their eyes dilated, like a yak capsulotomy or anything else. They put a drop to dilate their eyes. They wait about 15, 20 minutes, 30 minutes to let the eyes dilate. Then they come back in here and we put a drop to anesthetize both eyes. And the reason we use anesthetic in both eyes is because we want the eyes to stay open. If you only anesthetize one eye, the other eye gets dry and irritated. So we have both eyes anesthetized. We have a technician who holds the head against the laser. And basically I use a special lens that's designed for laser floater treatment. It's a mid-vitreous lens. And that lens, we put some jelly on it and we actually put it on the surface of the eye to allow us to keep the eye open and visualize. That allows us to also control where the eye is looking. So once we have the lens on the eye, my view is just to find where the floater is, make sure I know where I am. All the patient feels is a little pressure from that lens. That's it. No pain, no discomfort. They may hear some clicking sounds and even kind of feel like a clicking feeling when we fire. But we just have a clicking sound, and they don't see or anything except that maybe they see some bubbles floating around during the procedure. It takes anywhere from 5 minutes to 20 minutes, depending on the type of floater. You know, at first I tell doctors, you may give yourself 10, 15, 20 minutes because it takes a while to feel comfortable visualizing. For me, after doing so many, I don't take as much time to find the floaters. I can see it within a few minutes, and I'm not as scared to fire now because I know where I am. So for me, sometimes it's anywhere from 5 to 10 minutes, and I can take care of most of the floaters. After the procedure is done, the patients will be dark for about maybe 15, 20 minutes because all the flashes of light. It comes back very rapidly, and they don't have any restrictions. I tell them there's no specific drops I give them after the procedure. We do not see any inflammation in the eye. So I tell them, look, go home, we'll have you come back in a few weeks, we'll check the eye again. And they should notice a difference by the next morning. When the pupil comes back down again, most people will say, wow, doc, those floaters are better now, and they can go from there. And then they come back after a few weeks, and we talk about their symptoms and if there's any need for another session or not.